Welcome. My name is Dana Leach. I am the Chief Financial Officer and Administrator for Atlanta Oral and Facial Surgery. We've been providing services here in Atlanta for 30 years, and we've grown now to 21 oral surgery offices and 1 plastic surgery office. The East Cobb Surgical Center is our largest facility. It houses both our central service center as well as the state-of-the-art surgical offices. And in this facility, we will take a tour and you'll see all the state-of-the-art equipment that we use to keep us at the cutting edge of providing surgical and safe surgical services for all of our patients. This is the front desk area of East Cobb Surgical Center. This is where the front desk decipher all the insurance needs of all the patients, as well as handle all the paperwork that's needed to provide insurance and the claims.
Hi, my name is Jerry. I'm with Atlanta Oral and Facial Surgery Center. I'm the office manager here, and we pride ourselves with customer service as our first priority for the patients. From start to finish in regards to billing, we do handle all of the billing needs for the patient, including verifying benefits as well as following the process through with follow-up with the insurance companies. During the process, we do give estimates to the patients to the best of our ability of what your out-of-pocket will be and to maximize your coverage.
I'm Robert Wonderly, a oral and maxillofacial surgeon who has been with Atlanta Oral and Facial Surgery since its inception in 1980. Presently, I do practice oral and maxillofacial surgery, and I also function as the Chief Executive Officer of our company. Atlanta Oral and Facial Surgery has been in business since 1980, and we have developed 21 locations through the northern part of Atlanta. We have presently 18 oral surgeons who have had an extensive amount of training to get to their position as an oral surgeon and have had a good deal of experience. I also want our patients to know that we'll continue to provide the best care through continued education and improved technology.
This also is our CareStream 9300 X-ray machine. This is a state-of-the-art, very latest unit. It provides us to give a very minimum amount of X-ray to the patients and focus the X-ray on the areas of the face that really need to be exposed so we can get the most out of our 3D images as well as panoramic images. Recovery's here, and main OR is here where our anesthesiologist works.
I'm Dr. P.J. Shaner. I've been with Atlanta Oral and Facial Surgery for 14 years. I was originally attracted to this practice because of its longevity and its excellent surgical reputation. I did my dental school training at the University of Pittsburgh, where I grew up, and trained in oral and facial surgery at Albert Einstein in the Bronx in New York City. My background is essentially in removal of impacted teeth and placement and reconstruction with dental implants. What I'm known best for is advanced implant reconstructive cases with extensive bone grafting and full mouth reconstruction, especially replacement of teeth in a day, as well as general implants for replacement of teeth. I do a lot of wisdom teeth removal and sedation-based surgeries, and that is the basis of what I do on a daily basis. When a patient comes into my office, what they should expect is excellent service, the best value they're going to receive for their hard-earned dollar, and surgical excellence. Those are the 3 pillars of what we try to accomplish in my implant and surgical-based oral surgery practice. What really makes the experience the most unique for patients when they come into my practice is that we've done this before. We will take care of you like family, and we'll set you at ease. We deal with anxiety every day, and no one wants to be or hear the word surgery, but we'll do it in the most kind, compassionate environment for you or your family member that can be delivered.
I'm TC, I'm the head assistant, and I'm also the implant coordinator here at Atlanta Oral and Facial Surgery, the East Cobb location. My focus is on patient care, making sure the patients are comfortable, they're getting called back, and the needs that they need are met. And in my 9 years here, I haven't seen the doctors really turn away very many patients, especially when they're in pain. We get them in, we get them taken care of as soon as possible, and make sure everybody's happy.
I'm Jack Marasini, and I've been a patient at the Atlanta Oral and Facial Surgical Center since 2004. And one of the very first things that I think is very important about it is my first visit here. I was diagnosed with a cyst that had been missed for 20 years by everywhere else I had gone. And so through their ability to save the nerve and do the job, it created a very loyal person in me. Beyond that, every time I've come here, I feel like I'm very special. I feel treated very well, and the diagnosis have always been, and options have always been well explained. And thirdly, and as important, was I was a traveling person when I worked, and my time was very valuable, and they appreciated that, so I never had to wait long for an appointment. I never felt that I was being put behind anyone else, or my time was being wasted.
My name is Dr. Steve Levy. I'm an oral surgeon with Atlanta Oral and Facial Surgery. I've been with the group since 1992. I received my dental degree at Temple University in Philadelphia, after which I joined the United States Air Force. Part of my stint there was a general practice residency. At that time I realized that I enjoyed oral surgery and I enjoyed putting patients to sleep. And so I applied for an oral surgery program, which I participated in the University of Maryland in Baltimore. After that, I was on the faculty of Emory University for 6 years and taught in the oral surgery department. I then opened up my own private practice from 1982 to 1992, and I practiced in Roswell, Georgia, after which I joined Atlanta Oral and Facial Surgery. When a patient walks into my practice, they can expect to be treated with the utmost care and kindness. I'm very concerned about not causing pain to the patient and providing the best service they could ever expect. When a patient presents for consultation after the examination, I generally discuss the surgical procedure with them and explain that there are several alternatives of pain management. We are able to do procedures with a local anesthetic and or nitrous oxide. Many patients are extremely apprehensive and would like to not know what is going on during the procedure, and so we're able to provide an excellent level of general anesthesia so that when they awaken, they're surprised that the procedure is over and they've had an excellent experience.
Hi, I'm Gordon Angles, Surgical Coordinator for Atlanta Oral and Facial Surgery. I've been with the practice for 23 years, and I'm also a surgical technician, which means I go to the operating room with the doctors and assist them in their orthodontic surgery cases. Now, within the 23 years that I've been here, the quality of the doctors, the quality of service has just been excellent, and that's the main reason why I'm still here.
I'm Dr. Tom David. I'm a dentist, and I've been with Atlanta Oral and Facial Surgery for more than 5 years. I provide diagnosis and non-surgical treatment for patients with facial pain and orofacial lesions. What sets Atlanta Oral and Facial Surgery apart from others is the nature of the comprehensive care that's provided for the patients in the practice. When a patient walks into our office, they can expect that they will be treated promptly, with care, and with attentiveness to their chief complaint. What makes Atlanta Oral and Facial Surgery unique is the ability to provide comprehensive care in a number of different practice settings throughout the Atlanta area, paying attention to the complaints that the patient have and making sure that those are addressed. When patients make an appointment in our practice to see me, presumably they have problems with facial pain or orofacial lesions, and I'd like for them to know, number one, that I've had more than 20 years of experience in treating these patients. As a matter of fact, I've treated thousands of patients, and based on that experience, I have the ability to take a history from them and be able to decipher the things that are important and offer them a number of options with respect to non-surgical care. One of the things that a lot of patients have anxiety about when they come to see me is that they are fearful that they will require surgical treatment, and the fact of the matter is that less than 5% of our facial pain patients end up needing surgical care. So they should probably feel relaxed and less anxious about the fact that they're going to require surgery.
My name is Richard Rudolph, and I've been a patient here since last year when my dentist recommended that I needed 2 implants and sent me here for the implant work. Well, the main thing people need to know is that they tell you what they're going to do, they tell you what it will cost, about what it will cost, and then they actually do everything works out just exactly like they said it would. The cost estimates are very accurate. They're very efficient in the job that they do, and they just you don't feel any pain or anything when they do the work. It's just everything's just great.
Thank you for visiting us at Atlanta Oral and Facial Surgery and our East Cobb Surgical Center. And we will focus in all of our offices on patient care and patient safety, and we look forward to treating you soon.